Finally. Okay, I'm sorry for the delay, Al. I'm sorry for the delay, Al, but I think we can start. So we are going to be talking about men and mental health. But before we do that, I would like you to introduce yourself and just tell me a little bit about yourself. Who is Mr. Brian Mukoja?
Well, that's pretty a loaded question for introduction. All right, my name is Brian, probably known as Sir Brian.
Okay.
And currently residing in Botswana, but I'm in Zimbabwe.
Okay.
And I computer data security, that's what that is. And I love the Lord.
Oh, you love the Lord. Okay, that's nice. Welcome, Sir Brian, to our discussion. So, what do you understand about mental health? When we say mental health, what do you understand?
All right, from my point of view, that I do get it is that it's something that has got to do with the brain. Like you have to have health wise. It has to do with the brain.
Okay.
Mental health, it's an umbrella of many things. Just like when we talk about GBV and violence, it can have a lot. But in a nutshell, mental health means wellness mentally. So mental health is the wellness of somebody mentally. That's how I understand it. So if you are well in the brain, you might call it mental health.
Okay, yeah, that's true. Like you have said that it's a state of well-being where one is just you just emotionally, psychologically, and socially well. I think, let me put it that way. So can we talk about so Mr. Brian Mukoja, as you have said, that mental health has something to do with a person's well-being. They're having a state of mind that's well and being able to cope with normal life stresses and, being able to contribute to the society, right? So now I want us to talk about mental health and the African culture. So men and mental health in the African context. What can you say about that?
Okay. It has been always a taboo in our culture from where I'm standing and what I understand.
Okay.
Most of the time I find that in our African culture, where I'm coming from, if you are sick, let's say somebody who's got autism.
Okay.
Somebody who's got autism has got some mental illness it's a mental disorder. But for us, because we don't have the knowledge in our culture that there are such kind of diseases, we tend to take it like this is a white man's disease. That's one of the examples. Like even with Alzheimer's, you hear that it's an old man's disease, but you only find it in white people. So we tend to have negated, or we tend to have gone to the side of saying that these mental health issues are only meant for the other people that have got a different skin tone than us. So basically, it's never been spoken of, but it does happen. Depression and stress, it's also part of mental health, and it's not actually addressed in many cultures. Speaking from my experience as a man.
That's true. That's true. I've seen it. I've worked in a psychiatry clinic, and a lot of people with mental disorders, or a lot of people with mental health issues, you will see that people will not accept them, and even themselves, they'll be ashamed of their condition and they won't be able to come out. So now linking it to men, what can you say with mental health, this depression and Alzheimer's, autism, all these mental disorders and mental health issues? What can you say in Africa in relation to men?
All right, in relations to men, sorry about that. In relations to men in Africa, what happens is, okay, we might put the whole thing in an African context and say that it's a thing, because when we are told when we are growing up, on a male's perspective, we are logical. We do things on a logical basis. We are not in touch with our feelings. So when you talk about mental health, most of the times we have tend to think, since it's something that is feminine.
Okay.
So in our African culture, even as I talk to other men, it's the things that we talk about. A man can only tell you that, yes, I'm stressed, but their stress is only because they don't have money.
Okay.
And the way of opening up for them to tell you that they are stressed is because they have a relationship with you. If they don't have a relationship with you, they don't come out upfront to talk with you. So in a culture in Africa, even in a black man, what we tend to know is maybe we've got a nervous breakdown. But for us to speak about depression, we'll only see it at a later stage, because it's regarded as being weak if we take medicine. But then for our own information, something that you don't know, we have always had this saying, like something that you don't know won't kill you, but in actual fact, something that you don't know will actually kill you, because this is what we have grown up to. We don't know about many things like this. This depression, it's viewed as if it's a weakness, of which it's not a weakness. It's something that happens. And like what I said, from a logical point of view, men will be like, no, we still want to think it in our head, and then we'll say it. We won't even say it. We are problem solvers, maybe, if we can say that. So, but that one should not be the case, though it may be. It must not be the case, in the day and age that we're living in, because if we don't open up, we don't get the help that we need.
Okay, so you're saying that because men, they don't want to be seen as weak, or they don't want to be called weak, they end up not opening up and not saying anything. They only open up to people they're close to, and maybe they only open up if it's issues to do with money or something else that's not that doesn't look as serious, or something that is not big. Is that what you're saying?
Yeah, that's part of what I'm saying. You don't need to be pointing fingers when it comes to such kind of things, because most of the times, with people, when they're in when trust is broken, especially in men, in any way, in any relationship, trust is broken. It's very difficult for the person to come back and trust the other person with what they are feeling inside. If I tell you, Rumbi, that I am not, I'm having difficulties in going to the restroom at night, and then I do find out I've spoken to you in confidence, all right, and that's it. That's people tend to, you go and spread that thing. Now, as a man, if I hear it from another person now telling me that we had that you wet your bed and stuff like that, it destroys the confidence that I have. So now, on that point of view, it has been engraved in us, with many men, like, okay, it's better to keep what I know to myself, so that I don't need to talk to a counselor. I don't need to talk to a psychiatrist. I don't need to talk to a clinician. I don't need to talk to anyone. I just need to keep it to myself.
Okay. Okay. So, what do you think should be done for, for men to be able to open up and talk about their issues and talk about their problems? Like, what do you think can be done?
We all play an active role, every one of us, ladies and men included. Uh, it has become more rife now. It has become it's more bigger than the way that it was before. Uh, Dating back at the way that things have changed, the roles have changed. How you ladies you can now take care of yourselves, especially when it comes to relationships. And now the guy was there to take care of you. So now if those roles have changed, and now you tell him when you come to the house that no, I want you to love me and all that stuff. And he knows that he's supposed to provide. What I'm trying to get at is that we all play an active role, men and women. So what can be done is that we need to come at a stage of knowing how do we function, the purpose, what is our purpose as as a human being, as a gender, like as a man first and as a woman. Anyone, it's a given that when you are born, like you are a boy. When you are born, you are a girl. But for you to become a woman or a man, you have to develop into that. So in each and everything that we're doing, it has to go with stages. And then in that same event, we need to be encouraging each other that, okay, there are some things that we can speak about depending on what level you are at. You can't talk to a child using big words. You can't be talking about to a child who's 2 months, like there's a conglomerate of things, just using a lot of lingo that they can't understand. But if you tell them bit by bit, they do get to understand. So in each and every one of us, the man and the ladies alike, we have stages that we have. So for us to come out, we have to go into those stages, not blaming each and every one. So we need to start off like, okay, so we can start off by talking about how was your day? No, my day was like A, B, C, and D. But men, generally, if you ask me how my day was, I'll just tell you my day was fine. I don't go into details. You ladies, you've got a gift. You can go into detail like, no, I met a salesperson when I was going to work. Then this other person dropped the pen and stuff. And when it comes to that, we need to now understand, like, there's a certain way that we communicate. Each and every one of us, we can know how to communicate with other person. But in general, each and every man and every household should sit down and talk about all these things. It all starts with conversation, I think.
So you're saying we as the society, we have to we have to show that it's okay for men to communicate, for men to open up. So we as women or mothers or sisters, if we show that it's okay for you guys to open up and speak whenever you have issues, then maybe you men can be able to open up and speak whenever you feel that you're not okay. Is that what you're saying?
What I'm saying is that let's not go to the society first. It has to start in a space like a closed room, right? First of all, even if you go back to the inception of the humankind, we started off with two beings. So when it starts off in a family, whatever you see happening in a family is whatever happens in the family is what you're going to see in the community. That is transferred to the society, that is transferred to the nation, that is transferred to the whole world. But where it starts is the two people sitting down, a family.
Starts at home.
God, when He created us, He created things. If in our male home, where we have got a father figure, the father is not doesn't show or say things, because whatever the man does, that's where the whole family goes. So if I grew up not knowing how my father felt concerning some certain things, would he sit down with us and tell us that, hey, things are not working? In Africa, if a man does that, I think there's a certain way of knowledge, a certain way of wisdom that we need to come to, as even as we discuss these things across platforms. That's why I gave stages. Because if you come to a child who's 5 years old and you tell them about the problems that you're facing as a man, and you can't find the money, you can't find a job, it feels like you're being weak. But I think there's a certain way that you can communicate. Not saying that you're going to put the pressure on the child or on the family or on your wife to say.
Okay.
So it has to start with two people. That's what I'm saying.
Okay, I get what you're saying. So as parents, the parents should sit down with their children and tell them it's okay to communicate and talk about their feelings. So you're saying it starts at home and then it can spread throughout the whole society, the community, and the whole world, right?
True that.
Okay,
Yeah,
so let's talk about the stigmas around mental health. Like, what can
all right, like
stigmas around mental health in relation to men? Yeah, let me put it that way.
All right, in relation to men, there's not much a difference, because when you look at a stigma, you are afraid. Number one, you're afraid of what people are going to say. So that one becomes a stigma on its own, you as an individual. If I tell people that, hey, I've got anxiety, the Bible clearly says, especially, okay, let's go, if we are in a Christian setup, the Bible says you should not worry about anything. Let not be anxious about anything. But then when you come to the reality of it, we don't know how to mix that with what we are going through. So now it comes to a certain level of what are people going to say. Most of the times, it's stigma is caused by us. Number one, the person who claims to be the victim, because when you look, I can't do A, B, C, and D because I've got autism, or I've got I'm schizophrenic. People now think that it's like what we've grown knowing, it's a demon. You are demon possessed. So now that one is a stigma on its own, on my own, without it going outside. So now that one is carried on with people, even around us, because this is what we have already given them as our way of communicating to them. So stigma, that's how I view stigma. It starts with you, then also the people around us. We get to carry on the same thing that you have given us.
Yeah, that's true. I mean, people don't really accept, people who are mentally ill. They don't accept them, or it's either people who say terrible things towards that person, or they just say negative things. Or even if you have a mental illness, you might not even get employed, because to them it's like you said, you're demon possessed. Some people will think, okay, this person is demon possessed, or this person cannot work, when it's actually not true. A person can actually work even if they're mentally ill, because it's just a condition which can be managed. So that's very true. I agree with you that, it starts with you as a person, self-stigma, and then there's public stigma as well. So yeah, I agree with you. So can you share with me, have you ever experienced any mental health issues, or do you have any experiences that you want to share with us, or any particular incident that you want to share with us and say, you know what, maybe, I once experienced this, I had mental health issues, and maybe you couldn't get help, or maybe you couldn't probably open up or talk to anyone because of the you know, like you said, the stigmas, and you know what you say, that you know men are viewed as weak if they open up or when they talk about their feelings. Do you have any experiences that you would like to share with me and everyone who is on this platform?
All right. I'll first say this. When we're talking about uh, the thing being spoken in the family, mental health issues being spoken in the family, we create a platform. The platform for us to conversate. It's shown by the we call it the atmosphere in the room. I'll look at you as my anchor and I'll be like, okay, like now, the first thing that will come to my mind is like, okay, why would she want me to tell her about my life? And without her having told me about her life. So
Okay.
That is the point of view that I always see. But then with me, like what you are pointing out and asking, have I had a personal experience? No, I have not. I haven't had any mental breakdowns. But then fear, I was doing some research. I found out that fear is also part of, can also be part of mental disorders. But
Yes.
there's a certain type of fear, yeah. But then I think that is as far as I have gone. I think I still have got my mind still kicking in. When I want to be anxious, I have to reel it back and like, okay, come back. You don't need to be anxious about anything because the one who created you has got you in his hands. Okay. But then there are certain scenarios that would bring you to question what is happening around you. And people, when they look at you, they think that you're stressed. I think I had a thing of going to the hospital some time back. I had just a problem of breathing.
Okay.
And not before the COVID, not COVID. Not COVID.
Okay. Oh, it's all right.
Time back, long back, like 4 years back.
Okay.
And then the doctor who attended me was like, I think you are having panic attacks. I was like, but I'm not panicking about anything. What did help me is that I don't take things at first word. Although she is a medical practitioner,
okay,
and I'm not a medical practitioner, I have to go and find out, okay, and all the symptoms that were pointing to that I was not a part of that. Okay. So they gave me, and some of the medication that she gave me was just paracetamol. So then I was like, okay, how does paracetamol help me to cope if I'm having panic attacks? So then, yeah, I think that was the only part of experience that I had. Not necessarily me saying that I had anxiety, but yeah, I've seen people that have gone through, and I've stayed with people that have had depression. The people that have had the attention deficit.
Okay.
Which is something that we overlook most of the times. Like, you're not paying attention. You are there in person, but you're not there. So yeah, that's my personal experience.
Oh, okay. Thank you very much for sharing. So Mr. Brian, what advice can you give to men who have mental health issues? You know, maybe they have mental disorders, or they're just stressed, or they're just having, you know, issues that don't require medication, but maybe it requires therapy or counseling. What advice can you give to those men?
Okay. First of all, like what I was saying, what builds us up is trust. So we need to find the best where we know who to trust and who to talk to. Not every person that is out there listens and keeps in confidence what we have said. I always say to a lot of people, you don't, if you share some and you keep some. You share some things and you keep some as you get to know the person. Because some of the times, the thing is that you need to, number one is that we need to know. When we know, we do our research. Like what you're saying, you have pointed out that there's therapists, there's counseling, and then there's medication. Some of them, and then there's yeah, you can go for just psychological things that you can do, or exercises. So all those things are different when you look at that. So as men that are out there, you can look at what is happening to you, because then there are other things that people will take for granted. Like what I was saying, there are people. There's another thing that people do, which is habitual lying, which is also termed as it's a mental disorder. A person.
Yes, that's true.
We ask you, what is 2 + 2? You say it's 7. Where were you when this thing was happening? You say, no, I was not there, but you were there. And then you think that thing is just natural. We know that there are other things that are spiritual, and we know that there are things that are physical. And most of the things that happen in our lifetime is that we tend to negate them, saying that, no, we were born strong. We are Africans. So with my advice to men is that as we get time to learn, it doesn't take a lot. You just read through some of the things. The same thing that you do when you're reading your newspapers, the same thing that you do when you're looking on Facebook. Okay, if I'm talking about Alzheimer's, does it affect me? Have I experienced something that causes me to lie? Was it a once-off thing, or do I forget things easily? Do I need medical attention? Those are the same questions, simple questions that we need to ask ourselves as men. The other thing, number 2, if it's knowledge, then number 2, you have to find out where you are. That is the first question. It's self-introspection. You find yourself, where are you? Because where I am will also, do I like to be where I am right now as Brian? Am I satisfied with who I am right now? What has caused me to come to the point that I am right now? So that I will know if I've got any medical conditions. Then we do backdating. We find out, okay, some of the things are chronic. Is it me who started with it, or it's coming out from a generational thing? Not only rushing into a generational case that people that want to go to as ministers and stuff, but okay, do I need medical attention? So all these things, you're acquiring knowledge. You find out, like in the Bible talks about go to the anthill and observe. So the other thing that you can do is that you observe the people that are around you as men, because when the Bible talks about you being the head, you are there to be observant. You observe what is happening around you, so that you don't go through the same thing, so that your children don't go through the same thing, so that we can actually build the community and the society as a whole, even as Africa. Yeah. So yeah, I might talk a lot. That's it. Yes.
No, that's okay. That's okay. Thank you. So, ladies and gentlemen, Mr. Mukoja here said that all men who lie are suffering from mental health issues. I'm joking. What you said is true. You know, self-introspection is needed as well. Like, you as an individual, you need to sit down and identify, you know, your strengths and your weaknesses. If you have any issues, or if you have anything that needs medical attention, or that needs you to go and talk to someone, then you definitely need to go and talk to someone. So thank you very much for your contributions. So I saw a question here. It disappeared. There was a question. 1 second. I just need to check. I saw a question.
All right.
Okay, 1 second. Let me just look for the question. Oh, okay. Someone is saying, any tips on question? Okay, there it is. Any tips on anxiety around people? Yeah, any tips on anxiety around people? Do you have anything that you want to add on this one, or do you want to answer this question? Do you have any tips that you can give this person? This person said, any tips on anxiety around people?
Okay. Oh, what I would say is the very first thing that we need to understand as human beings, we are different. Number one, that is what you need to understand. There are two words that we usually use. We use that a person is an extrovert or an introvert. So now, since this one they have already said around people, now we wonder what kind of people, which crowd are you talking about? Is it a crowd? Like now, what I would advise, since now we're in COVID, social distancing. Social distancing. All right, but okay. If you're an introvert, you are not. We can safely say that maybe you are not anxious around people. But if you are an extrovert, then you want things to yourself. You don't want to be around people. So the tips, I think they need. With me, what I would say is that they need to find out where they are first. When they mean that they're anxious about people, what makes them anxious around people? Is it because there's neuroethics, people that they talk about, neuroethics, that we've got two things that control our minds, the cold and the hot. The cold, it deals with our feelings inside, then the hot talks about how we socialize with people. So then now when you've got those things happening around you, if you are going to be around people, you now have to see, okay, what is triggering me being anxious around those people? Maybe it's a smell. All these things are interlinked. There's something that happened when you were a child, and that smell comes into you, then you start feeling like, I've been here. Then now you see those things that I was talking about, the fear. You might feel then your brain is telling you, send signals like, you should do something, run, or don't be around people. So my tips is that, okay, first find out what suits you. What suits you? Yeah, that's the tip that I can give.
Yeah, thank you very much for that. I was thinking the same actually when you said that they need to identify what triggers the anxiety or what causes them to be anxious around people. There could be something maybe that happened in the past, or it could be that the person is an introvert, like you said. A person might be an introvert and they just don't want to be around people or around crowds. So obviously they'll become nervous or they become anxious. So it's very important to find what's triggering the anxiety or what's causing you to be nervous or anxious around people. And also, it's also important to find people to talk to. That's why we are here, right? Talking about men and mental health. It's also very important for you as a person to find someone to talk to. It could be a counselor, it could be a psychologist. We have a lot of people, we have a lot of counselors, a lot of psychologists, just that people don't know about it or they're just ignorant about it. But I think it's also important that you find someone to talk to. Maybe they can help you identify what's causing the anxiety or what's causing you to be anxious around people. So thank you very much for your contributions. And I think we are going to end here. So, Mr. Mukoja, do you have anything that you want to say before we end this live? Any last words?
I wanted also I wanted also to point out on things that are concerning, like you see now, when that person is talking about anxiety, in Africa, we've got this thing of self-medicating ourselves.
That's true. That's true.
On ourselves. And this medication that we give ourselves, I'll come to you, or you come to me as a man, like, hey, you know, I'm stressed. What should I do? And with me, I've been given medication by my okay, psychologists, they don't give, my psychiatrist. If I go and visit the psychiatrist, they will give me medication. The psychologist or the counselor will be there just to help me and see if I need medication. But then this other one has been given medication. And then you give that medication to me thinking that it's going to work, because then they were facing that same issue. So what I want to point out, with the advancement of technology, the other pills that are there calling, since we know that we've got watches that are smart, there's also smart medication that is happening right now. There are pills that they take, and even people that are well in the head, in the mind, they take those things to maybe ward off jet lag. They are tired, even to boost their self-confidence when they are around people. It's more like a drug. And people, they've got ways of defending those things. So what my advice is that, and some of the words that I'm going to say is that, don't go and take on medication that you have not been given. If you have not gone for therapy, number one, if you have not taken time to find out what is going on with you, don't take medication handed off because you're saying that this is my friend and they've given you ABC, they've given you these pills so that you can be smart. Everyone has got a way of dealing with issues. Everyone has got a way of dealing with stress. And but in our way of dealing with stress, we need also to come to a realization that some of the things you cannot take them on your own. The same thing, I wanted to go that way. There's this other person who just said, if you have got a headache, if you've got the guts to go and go and see a medical practitioner, you won't go to a housemate if you've got a physical problem. You go to the people that are qualified to help you. So the same thing, since we are talking about mental health, if you are a man, you won't entrust your health, your mental health, to someone who is a novice. So you need to take precautionary measures as a man, and that is being made now. Going for checkups. I recall, with me, my self-experience, I recall that I did some checkups to the hospital. I went to just check some things in my body, and people were asking me, "Are you sick?" I was like, "No, I'm not sick. You just need to go for checkup so that you know what is happening," because there are underlying issues. Like with these things, with mental health, the problem that I've seen, it will only strike you when it is now in your backyard, when it's now in your room. That's when you see like, "Ooh, this thing is bad," because now it's in your own territory. But it has been always there, and then we don't take time to cut it off when it's still young. So for men, let's not take medicine that we have not been given, prescribed for by people that are qualified to do that. And also, it's not a weak thing for you to be a clinician, to be a therapist, because also that's the other thing that is speculating that those jobs, they don't work. How can you be a psychologist? Doesn't pay anything off. But it's something that helps us. We need to have a knowledge-based economy. We need to have a knowledge-based individual who transfer the information
Yeah, you're right.
to the generation.
Yeah, you're right. We need to acknowledge all the psychologists, the therapists, the psychiatrists. We need to acknowledge them. And like you say that, I think as a person, if you see that you have a problem or you just have, mental health issues, I think you should just go and look for, health professionals like psychologists and therapists. Those people can actually help you and help you identify what's wrong with you. So if you don't go there, that's when you end up, giving yourself medication and you don't even know if it's the right medication to take. So like you said, it's very important that if you have an issue or if you have a problem, I think it's important to just, you know, seek help to people who are well trained and who know what they're doing. Because you might say, okay, I have depression, and then you go to your aunt or your uncle, but they don't really have the knowledge, or they don't really know how to help you properly. They'll just give you advice according to their experiences, and maybe at the end of the day it won't work. You just go back and say, you told me to do this and this, but it didn't work. But if you go to a therapist is more like a guide. So a therapist will be there to guide you and help you to find solutions to your problems. So it's very important to seek professional help, just like what Mr. Mukoja said. So thank you very much for, you know, blessing us with your knowledge and your information. And for everyone who was watching, thank you very much for coming. Please don't forget to like our page, Revolve Generation, on Facebook and on Instagram. And don't forget to go and subscribe on YouTube as well. And I hope to see you next time as we continue to have this discussion about men and mental health. So, Mr. Mukoja, thank you very much.
Thank you very much. It's been a pleasure.
Enjoy your evening.
Toodles.
Okay.